are you doing today?
I'm good. How are you?
I'm good, thanks. My name is Jenn Hip Goni. I'm an occupational therapy student with the University of St. Augustine. Before we begin today, can I please have you confirm your full name and date of birth for me?
Yes, it's Kimberly Wynn, October 24, 1995.
Okay, perfect, Ms. Wynn. So what I have planned for you today is just to run through some measurements, and we're going to establish a baseline. This can allow me to track your starting point. That way we can monitor your progress as we move forward in your therapy sessions. You may experience some pain or discomfort. If at all you feel those symptoms, please let me know and we could stop it, and then we could find another alternative way. I'll be walking you through and explaining each motion as we progress in our therapy session today. If you have an alternative plan of care for yourself today, we could then modify it, but I feel like this is what's best for you. Do you have any questions for me?
No, I don't.
Do you have your consent to begin?
Yes.
Okay. So our first testing is going to be a manual muscle testing. This is going to be testing hip extension, the prime movers of the gluteus maximus, the biceps femoris, the semitendinosus, and the semimembranosus. This is going to demonstrate like if you're swimming in a pool. You're going to be laying prone, which is on your stomach for me. If you mind getting on your stomach, please. I'm going to be placing this pillow underneath your abdomen. And I'm going to put this mirror in front of you. That way you can keep a check on your facial expressions. I'm going to apply a belt for stability. So I'm going to demonstrate the motion on you. Do you mind if I put my hand on your pelvis and your knee?
You can.
Okay. So this is the motion that I would like you to perform. Do you have any pain or discomfort with that?
No.
Okay. Can you perform that motion for me? Okay, perfect. So I'm going to place you in a 50%, and I'm going to place my hand on your knee, and I'm going to place my hand as well as on your pelvis again. And when I place you in that position and apply resistance, hold and don't let me move it, okay?
Okay.
All right. So hold, don't let me move it. Okay. So you could relax now. You have demonstrated that you are 5 out of 5 due to the fact that you're able to hold maximum resistance against gravity. So our next measurement is going to be a goniometry reading, and we're going to be laying prone, which is on your stomach, if you don't mind doing that for me. I'm going to place a pillow underneath your abdomen. I'm going to place this mirror in front of you, that way you can keep an eye on your facial expressions. So for hip extension, this is going to demonstrate like if you're swimming in a pool. I'm going to place a belt on your pelvis. Do you mind if I demonstrate the motion for you?
You may.
Okay. I'm going to place my hand on your pelvis and on your knee. Okay. And this is the motion that I want you to demonstrate. Is there any pain with that?
No.
And your end feels were soft to firm.
Okay.
I'm going to palpate for your greater trochanter. Can you internally rotate for me? And externally rotate. Okay, perfect. So my axis is going to be at the greater trochanter. My stationary arm is going to be parallel to the torso, and my movable arm is going to be parallel to the longitudinal axis. And it looks like we're starting in 5 degrees of hip flexion due to the fact that she has the pillow underneath her abdomen. Do you mind performing that motion for me? Okay, so you can relax. So you went from 5 to 0 to 25 degrees of hip flexion. Normal is 0 to 30. Thank you.
Thank you.